Worker who died from COVID-19 at home paid tribute to her today, but also questioned why they've been left alone to deal with her death. Laura Tanner from Basildon leaves behind a husband and two sons who are asking searching questions. Why wasn't she tested? And why weren't they? Ria Chatterjee now with a son's tribute to his mum who died with the virus.
You must be going through just an unimaginable time at the moment, Ethan.
Taking things day by day is like an understatement because I don't really know what I'm doing every day. It's difficult knowing what you're doing every day anyway during the lockdown. But with this on top, you just sort of lost. It was a hard time at the funeral as well because we could only have 10 people there. But being able to then not hug friends and family and not being able to comfort each other is a bit of a struggle.
Your mum worked for the NHS for a long time. Did she love her job?
For a long time, she did. She absolutely loved her job, and her work's been amazing. They've been helping. They've donated money to her Just Giving page, and they've all got together on the day of Mum's funeral on Zoom, just to show you how much lives my mum touched. Is one day my mum was getting a bus with this lady, and they were obviously talking because we got a card through from this lady who we'd never seen or heard about, and she wrote a little story about how they met on a bus.
Before this happened, did you sort of had a sense in your mind that it wouldn't happen to you?
Yeah, definitely. Like, I think a lot of people are I've got that sort of feeling where people are not realising how much this affects everybody without it happening close to you. And there are people still going out. I think my mum could have been tested, and I think we should have been tested as well if it had been in the house and passed around.
And so do you have a feeling that after your mum passed away that you were sort of left without any information or any sense of what to do, given that the virus had been in the house, as you say?
Yeah. Literally, all we got told was 2 weeks. We had to self-isolate. That's all they said. They didn't say anything else because we didn't get told anything. We had to find everything out ourselves, and asking the hospital and things like that was a struggle to get hold of all the answers. Just taking it, like you say, like day by day, ups and downs all the time.
Ethan Tanner remembering his mother. And the family of a doctor have paid their tribute to him after he died with COVID-19. Dr Kamlesh Kumar Masson from Thurrock was working as a GP when he caught the virus. He was 78 and has been described as a committed, loving and generous man. He'd worked for the NHS for 47 years. The growing toll of those working in the NHS and patients who have lost their lives in hospital has led to another increase in the number of people in London who've died with the disease. There have been a further 87 deaths in the capital's hospitals, according to NHS England. That brings the total number of those who've died in London to nearly 4,700. And the rise in doctors and nurses losing their lives with COVID-19 has again shown why having the correct PPE is so crucial. A third of doctors who look after coronavirus patients have reported running short of long-sleeve gowns or full face visors, according to the Royal College of Physicians. Well, joining me now is Dr Chinegwundoh, who is a consultant respiratory physician and clinical director at Kingston Hospital. Thank you so much for joining me this evening. First of all, we keep hearing of these cases of NHS frontline staff sadly losing their lives, and then we hear these figures today that a third of doctors looking after patients with coronavirus say they're running short of PPE. And your reaction to that?
Well, I've obviously been on the front line throughout the whole pandemic, and I'm very lucky at Kingston Hospital. We've been very fortunate to have adequate supplies. There have been times when we've had to make adjustments. But overall, it's about really getting the equipment to the front line. And often we're using up so much of the masks and the gowns. And sometimes in the course of a shift of 12 hours, when you've got a full room full of equipment, by the end of the shift, it's running low. And it's about making sure we've got the support staff to get the equipment up to the ward where it's really needed, and we're really fortunate to have a whole team of people at Kingston who have been doing this night and day. I'm very proud of all my colleagues who've done this, but I think in any given hospital we're using unprecedented amounts of equipment, masks and gloves and aprons and gowns, and we need the right number of staff to help us get the equipment up to the wards, because it's often there on the premises, so we're using it so quickly we need to get it up to the shop floor, as it were.
Dr. John, I mean, the government say it is a priority getting the PPE to those frontline NHS workers. And we also heard from the government today at the daily press briefing that families of frontline staff who die, who sadly lose their lives, will be given £60,000 as compensation. Your view on that, is it enough?
I think it's a really good start because, you know, as many of my colleagues and my friends know, I lost my father recently from coronavirus. And there are going to be, of course, expenses, and some people, you know, the family member that's died was going to be the breadwinner for the family. So this £60,000 will definitely help, as well as all the pension benefits that staff will get. And it will then raise questions whether other frontline workers, bus drivers, care workers also will get some form of one-off payment to really help them that initial period. I think the government has done a really good job in identifying that people do need help right now, and they will get more help, hopefully, from the Pensions Agency and other authorities as we go through the pandemic.
Oh, Dr. John, very, very sorry to hear about your father there. Can I just ask a quick question of you, because you specialise in respiratory illness. We know so little about COVID-19.
Yes.
What have you learnt about this virus, what, you know, that could possibly help in the treatment as well?
Sure. Yeah, well, it's changing all the time, and in the space of the last 6 to 8 weeks, we've learnt so much more. For example, that it's not just about a pneumonia, because when you compare the data to normal viral pneumonias, this is a much more deadly virus. And we're realising that it's very hard for patients to get the oxygenation, the amount of oxygen you require for your body to work. And that's something that's different from viral pneumonias. So we're wondering whether there's small clots in the lungs, whether parts of the lungs collapse down and can't get any air and oxygen into them. And that's making us really use different methods of treatment. So, for example, at my hospital and others around the country, we're using something called CPAP, which is continuous positive airways pressure. And we use a sort of a hood that we fill with oxygen and use pressure to push the air and oxygen into the lungs, push it into the bloodstream. And we've shown that lots of patients who normally would have either died or had to go to intensive care for a tube down their throat and a ventilated machine have avoided that. Certainly in our hospital, about half the patients who've had this treatment have avoided those unfortunate outcomes. So we're learning how to deal with it as far as ventilating the patients and getting the oxygen in. We're looking very much for clots on the lungs, so our radiologists have been great in getting all these patients scanned so we can give them blood thinning medication when required. But literally every day we are finding out more and more, and there's amazing networks. Yeah.
Thank you so much, Dr. John. Thank you so much. We could talk. We hopefully will talk again about the subject, but thank you so much for joining me this evening. Thank you. The Prime Minister returned to work after he contracted coronavirus and told us today that the lockdown will continue, saying we're at the moment of maximum risk. Our political correspondent Simon Harris went to Boris Johnson's constituency in Uxbridge to find out what people there made of it.
This is what lockdown looks like on Boris Johnson's high street. 5 weeks after the Prime Minister told everyone to stay at home.